You may have heard about Brixadi. This is an extended release buprenorphine injection. It lasts for 1 week or 1 month, and it was just approved by the FDA for the treatment of opioid use disorder here in the US. Brixadi is also being used in Europe and Australia, where it's actually called Buvidal. Before beginning Brixadi weekly or monthly, you need to be on sublingual buprenorphine, aka Suboxone, for 7 days. It's the same requirement for Sublocade, the other long-acting extended release buprenorphine injection. A few questions that you might have. Is extended release buprenorphine better than sublingual buprenorphine? i.e., is Brixadi better than Suboxone? Well, before I jump into that, I'm just going to let you know I'm going to call Brixadi and Sublocade XR Bup because they're both extended release, aka XR, versions of buprenorphine or Bup. And I'm going to call Suboxone sublingual Bup. Back to the original question, is XR Bup better than sublingual Bup? It depends on a bunch of factors. XR Bup is going to have much more stable Bup levels in your system with a much longer and slower decline after a dose. On the other hand, sublingual Bup is cleared much more quickly than XR Bup. A dose of sublingual Bup typically lasts 36 to 48 hours. And anyone taking sublingual Bup or Suboxone knows that you can feel the ups and downs of Bup in your system if you miss some doses or you're just not on a good, stable dosing regimen. With XR Bup, the dose is going to last a whole week or a whole month, depending on the formulation, so you won't have those daily ups and downs. Another thing is XR Bup can't be stolen. It can't be lost since obviously it's been injected directly into your body. With XR Bup, you might not need as many medical appointments and urine drug screens since the provider will know that the Bup is not being misused or sold. Finally, with XR Bup, you won't have to go to a pharmacy. We all know the hassles of waiting in line, being told that they're out of stock, that there's a problem with insurance or a prior auth is needed, etc. Another issue, is XR Bup safe? Yes, it is, but XR Bup can definitely hurt when it's injected. And there's a slight risk of some injection site reactions like redness or itching. So to summarize, XR Bup, i.e. Brixadi and Sublocade, are probably going to be more convenient and less complicated for most folks. But the injections can hurt, and they might have some mild to moderate side effects at the injection site. Well, one, Brixadi offers a weekly injection. Sublocade is only available as a monthly. Brixadi actually has 4 weekly dose options and 3 monthly dose options. Sublocade only has 2 monthly dose options. 2, Brixadi can be injected under the skin at multiple sites: the buttocks, the thigh, your belly or abdomen, your upper arm, while Sublocade can only be injected under the skin of the belly or abdomen. 3, they're made by different drug companies with their own proprietary technologies for sustained release. 4, this is more for the providers, but Brixadi doesn't need to be refrigerated, unlike Sublocade. 5, depending on your insurance coverage, Sublocade can get pretty expensive, on the order of $1,500 a month. We'll see what the cost of Brixadi will be for patients now that it's been FDA approved. Brixadi was actually deemed safe and effective by the FDA in 2017, but because of Sublocade's orphan drug status, it was allowed to have exclusive market access for 7 years since 2017, and Brixadi wasn't allowed to come to market. Meaning, as addiction treatment providers, we didn't really have access to another potentially helpful tool to help fight this opioid epidemic. Regardless, here we are now, and it's good to have multiple options in the toolbox to treat opioid addiction. Now that it's FDA approved, we'll see how accessible and affordable it's actually going to be for people.